We have the opportunity now to have a listen to something very special. And this is the launch of the New Zealand Drug Foundation's model drug law. This is a document that has, well, it's hot off the press. It was just printed yesterday, I understand. But it has been years in conception, really, and quite some months in the actual putting together of. It's intended as a conversation starter, not necessarily a document that we can just hand to government and ask them to write it down and debate it and put it into law. So I'm really interested to see what it is in it, and here to present it to us is Kali Mercier. Kali is Senior Policy and Advocacy Advisor at the Drug Foundation, and she's available to take questions from you as well as soon as she's done with her presentation. Kali, welcome.
The little clicker. Tēnā koutou katoa. Ngā mihi nui ki a koutou katoa. Karanga mai, mihi mai. Ko Kali Mercier toko ingoa. Kua tai mai mātou ki te tautoko ko te kaupapa o tēnei wā. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. So, I thought I would start this presentation with an embarrassing photo from when I was a child. I had a slightly non-conventional childhood. I grew up in one of the first mixed flats in Dunedin. So this is 1975. It was a great scandal covered at the time in the Otago Daily Times. Editorials were written about the fact that men and women were living together without being married. So this is me, my parents, and my flatmates. So 1975 was a really long time ago. It was quite different. We had no internet, obviously, no mobile phones. We had no Snapchat, we had no WhatsApp, we had no Twitter. We had no avocados, at least no avocados in Dunedin. You may have had them up north. Interestingly, given the job I'm now in, we used to have regular raids from the police at our mixed flat. I think the thought process was that because we were depraved enough, or my parents were depraved enough to grow their hair long and live in a mixed flat, they'd be also depraved enough to smoke cannabis. So I worked out that this photo was taken in October 1975, which is a very special month, because it's the month that the Misuse of Drugs Act came into force in New Zealand. So I am the same age as the Misuse of Drugs Act, which is one of my great claims to fame. So I like to flatter myself, it has not aged as gracefully as I have. It has not moved with the times in the same way that I have. So like this horrible old photo, it's still in black and white. It's still locked into the thought processes of 42 years ago. And it's still convicting and criminalising people that we think need actually support and our compassion. So we know that New Zealanders are ready now to talk about change and drug law reform. So we have put together, we'd like to move the debate on, basically, put a stake in the sand and say, well, here's something that it could look like. So we've developed Whakawatea to Huarahi, which is, as we just heard, is hot off the press yesterday, and we're going to give out copies soon as the talk's finished. So Whakawatea means to clear away, to cleanse, to purify, and Huarahi means a pathway or a track. So Whakawatea to Huarahi is about clearing the pathway forward. It's about moving the question from whether we should change things to how could it look. So I just want to emphasise it's a conversation starter. It's not a final word by any means. But it is based on evidence and research from around the world about what works to reduce drug harm. So why do we need to change our law? I think we've heard lots of really good, compelling reasons for that today. We've used MODA, Misuse of Drugs Act, to convict thousands upon thousands upon thousands of people, and every year we convict a few thousand more for possession or use of drugs. And yet, despite all these efforts, we still have some of the highest drug use rates in the world. So I'm sure everyone knows Albert Einstein's quote that the definition of insanity is to keep doing the same thing over and over again and expect a different outcome. And yet, that's what we're doing with our drug law. We keep punishing people. We keep thinking that if we punish them harder and better, they'll stop taking drugs. Well, it hasn't worked, and it's not going to work. So building on that quite simple understanding, we came up with 5 goals that we thought we should have in any drug law. We started with the idea that a drug law should be there to minimise harm from drug use. It's a really key goal for any drug law. So, for example, that means if people do decide to use drugs, they start later, they use less frequently, they use less heavily. And it also means that young people are particularly protected from harm. And of course, we want people to be able to access treatment when and if they need it. So quite an obvious goal for a drug law, but we're not really getting it right under the current law. Currently, individuals and their families obviously struggle for support to know who to turn to. There are huge waiting lists. And also, we've heard people don't seek help because of the stigma associated with drug use as well. So we need to get better at that. We have to. Secondly, we need to respect human rights. And for us, that is about making sure that any penalties for drug-related behaviour are proportional to the harm that are caused to other people. And it's also about equal access to healthcare for everybody as well. Our third goal, safer communities. I don't think anyone would argue with that one. And it's also one of the priority areas for our national drug policy. Fourth goal, equity for Māori. This one is absolutely key for us. Māori suffer disproportionate harms from drug use in New Zealand, and also they suffer disproportionate harms from drug law in New Zealand as well. They're more than twice as likely to experience a substance use disorder in their lifetime, which is just horrifying. 40% of those in prison for drug issues, for drug crimes are Māori, and that's despite the population being around 15% for our international visitors. And they're also significantly more likely to report legal problems from cannabis use as well. So we need to do much better on that one. 5, obviously, whatever policy we put in place should be evidence-based and should be reducing harm from drugs. And we are not spending our money in the right balance at the moment. We've heard a bit about this already today, but we've got a little image to show you. Drug harm costs about $1.8 billion per year in New Zealand, according to the Drug Harm Index. So these are figures from 2014-15. In that year, we spent $78 million on health interventions for illicit drug harm, and we spent $273 million on police, courts, and corrections. This figure doesn't include customs, so if you put customs expenditure into the mix as well, you've probably got around 20% expenditure on health versus 80% expenditure on enforcement. And this is even though we know that health interventions have a much better return on investment than enforcement does. So we need to address this imbalance here. So working from our goals, it's quite obvious, I think it's not going to be a surprise to you that we want to replace MODA. And we want to replace it with something quite different, something radically different, but something that's not radical. We're proposing an approach that was recommended by the Law Commission and has been tried and tested in Portugal and elsewhere, and we've heard a little bit about this model throughout the day. So basically we want to remove criminal penalties for possession, use and social supply of all drugs. We want to treat drugs as a health issue rather than a criminal issue. And alongside that, of course, we need to invest more heavily in prevention and treatment at the same time. So you saw the spectrum, or a version of the spectrum, earlier on today, so I won't spend too much time on it. But basically, on the left-hand axis, you've got the social and health harms, and on the left-hand side, along the bottom, you've got the different types of regulation. So you've got prohibition on the left, and you've got unrestricted access at the other end. So under both prohibition and unrestricted access, you've got the highest possible social and health harms. And this is because those markets are completely unregulated, basically. So they're quite extreme. They're not responsible, they're radical. It's towards the centre of the spectrum that you start to get responsible regulation. So we're proposing moving from prohibition to a decriminalisation model, as I said, combined with a harm reduction approach. So I would just move on to what this would actually look like in practice. Like how would it work on a day-to-day basis? So here's a case study. This is Bob. So let's say Bob, is found by police with some meth, a small amount of meth in his possession. So what the police will do is they'll give Bob some brochures with health information and legal advice, and they'll issue him with a mandatory caution. And they'll then refer him to a very brief intervention session, which would be held at a community and alcohol community organisation of some kind of service. So at this brief intervention session, Bob would have a very quick chat with the service, and they very quickly established that Bob was struggling with his regular meth use, and it's becoming an issue for his work and family life. So he's offered a range of treatment options, and the outcome for Bob is very positive. You'd be pleased to know. He seeks help. In time, he reduces his use, and he's able to get his life back under control. Well done, Bob. He doesn't have a conviction, but he does have much better life outcomes. So we're proposing a tiered system based on the harm profile of the drug. That's also what the Law Commission recommended. So if Bob was caught with a Category B drug, he wouldn't be sent to this intervention session on the first time he was cautioned, he'd be sent the second time he was cautioned. If he was caught with a Category C drug, he'd be sent on his third caution. And in practice, that means that it's pretty unlikely he'd be sent to to an intervention at all with a Category C drug. Instead, he'd be given health advice, he'd be given information on how to seek help if he needs it, and then he can get on with his life. And the idea there is that, as a rule of thumb, the more likely a drug is to cause harm, the more likely Bob is to need a health intervention. So we want to make sure that people who do need help get it, and the people who don't actually need help have as little possible interaction with the system. So just to emphasise, drug use would still be unlawful under our model. It's not a legal model that we're proposing. It's just that the penalties and the focus have changed from what we currently have. So I think it's quite clear what the advantages of the model would be. It would dramatically reduce the number of people being convicted. Bob wouldn't have a criminal conviction on his employment record. And police could also reprioritise their resources towards solving some of the more violent crimes, or more important crimes perhaps. The model also makes it much easier for people to access treatment, hopefully at an earlier stage than they currently do. So I also need to emphasise again that, and we've heard today, that drug use won't rise substantially under this model. There's examples internationally of this model being implemented, and drug use doesn't rise. Especially youth use doesn't rise. So there may be, like in Portugal, there was a very small increase in the adults who were using, but that was actually went up at the same rate as in other European countries at the same time. So I don't think we can put it down to the change in law. The other thing to think about with Portugal, though, is that they put a huge amount of investment into harm reduction and treatment programs at the same time, and we really need to see that here happening at the same time. And because we're quite impatient, we'd like to see all this happening by 2020. We think it's perfectly possible. We'd like to replace the Misuse of Drugs Act with a whole new law modelled on the Law Commission recommendations by 2020. And once we've done that, we'd turn our minds to cannabis. So this very large figure here is the number of people who flout our laws every year and smoke cannabis in New Zealand. So it's 11% of those aged 15 and over. So that's an awful lot of people that we're currently calling criminals, and we think it brings the law into disrepute, obviously. So looking back at this spectrum here, we think it's high time that we move towards the model of a responsible legal regulation, right smack bang in the middle of that curve, so the lowest possible social and health harms. And for me, the key reason that we need to regulate cannabis is that harm it causes can be mitigated much more effectively if it is regulated. If it's regulated, we've got a better chance of minimising the number of people who use cannabis and minimising the harms that it causes, and we've got a much better chance of minimising harm to young people as well, making sure it's much harder for them to access cannabis than it currently is, which is not very hard at all. And because we are a health-focused, evidence-based organisation at the Drug Foundation, we've gone for a fairly restrictive model of regulation for cannabis. We think it's really sensible to start cautiously and to monitor things as we go along. So I'm not going to go all guns blazing. We're basically proposing a model that focuses on making cannabis look as boring as we possibly can. Okay, so it shouldn't be glamorous, it shouldn't be sold on every street corner, there shouldn't be billboards advertising it as a luxury product. We want to steer clear of those cannabis lattes and those cannabis lollipops. But at the same time, we need to make sure that access is free enough that we take the stuffing right out of that black market. So if we restrict it too much, the black market will just fill the gaps, which is not what we want. So we need to strike a bit of a balance there. So what will it look like? Okay, so in terms of growing, we would allow sale by licensed growers. It wouldn't be very difficult to become licensed as a grower, and the number of growers would be determined by the market. And we've chosen that route rather than a more prescriptive, centralised model, because one of our goals for our regulated market is actually that it should promote community development. We see this as an ideal opportunity to bring some legal income into some poorer areas of New Zealand that could really do with it. So we want to promote community development, but we also want to limit the potential for growth of a big, powerful industry, such as we see with alcohol and tobacco, and such as we're possibly starting to see in America. So we're proposing keeping cannabis farms as small scale as possible by restricting their size, and we'd also provide active assistance for existing small scale growers to enter the legal market. And as well as commercial growing, we would allow people to grow up to 3 plants at home for their own use. So you could gift cannabis to your friends, but you couldn't sell it. In terms of selling and buying, we would sell cannabis from licensed shops, and licenses would be allocated centrally. Shops would only be able to sell cannabis and cannabis-related products, and there would be regulations about not setting up a shop within a certain distance from another shop, not setting up a shop next to an alcohol shop, not setting up a cannabis outlet near a school or church, that kind of thing. So we'd like those regulations to be set centrally rather than delegated to local councils. And the reason for that is when we look to alcohol, we see that where local councils have been given the opportunity to set their own policies, what's happened is that the alcohol industry has come in all guns blazing and put a lot of money into making sure those local councils are not able to make the decisions that they want and need to make about the number of outlets and the opening hours and that kind of thing. We don't want communities to be facing that kind of pressure when it comes to cannabis, so we think those regulations should be set centrally. And we'll make sure that rules about density of shops and so on is built into the law. But we also want to be able to give local communities a say over whether cannabis should be allowed to be sold in their community or not, so they would have a power of veto over allowing shops at all. And as I said before, shops would be as boring as possible. So this is some pictures taken by my colleague who was in America recently, in Portland, Oregon. Of some quite boring doors, so on the outside, quite boring shops. There's not much signage, there's limited entry, there's health warnings and so on and so forth. So in our model, there'd also be prominent health warnings and public information on display, and staff would be well trained. You'll notice in Portland the age limit's 21, and we've heard various age limits in different places, 18 in Canada or 19, depending on what the provinces decide. We've settled with 18 for our model. We had a lot of thought about this one as well. It's not a simple, straightforward decision at all. But we've chosen 18 really for practical reasons. So we don't want to encourage the black market to step back in for 18-year-olds because we know they're really 18 to 25 is our biggest group in terms of use. We want to be able to regulate their use as well. So we want to be able to put in place actions that will minimise harm for them, and we can better do that under a regulated market. So we'd try and focus on limiting their use through restricting advertising and keeping prices high and other harm reduction measures. And then, of course, anyone who is under the age of 18, we would have strict penalties in place for ensuring that licensed outlets did not sell to them in much the same way we do with alcohol. So, consumption. This was also a good discussion. A lot of thought went into this. So there's different arguments about whether you should allow cannabis in bars and cafes in public. So one argument goes that if you have cannabis in a bar, then you'll reduce the amount of a much more harmful drug that is consumed there, alcohol. And you may even have reduction in crime outside bars, there'll be less violence, that kind of thing. The opposite argument is that if you add an extra harmful subject into the mix, what you're doing is just compounding the harms, the health harms, and you will also be encouraging new people to try cannabis and expanding the market. And there's also other considerations, like we don't know, for example, if you put cannabis into bars, would you have worse or better outcomes in terms of traffic fatalities on a Friday night? We simply don't know the answer to these questions. The research is really not there yet. So we went with a very cautious approach again, and we've decided consumption should be at home only or at licensed events. And we could, of course, revise this later if international research gave us reason to think that was a great idea. So how would we regulate it? Well, Peter Dunn already talked about this a little bit. Under the psychoactive, we've already got this great framework there in the Psychoactive Substances Act. It was actually set up to regulate low-harm substances such as cannabis. So it already has a regulatory authority that could license growers and retailers. And it has a regime covering marketing, retailing, and penalties for breaches as well. It's all just set up. I mean, it does need quite a bit of tweaking, that is true, but the framework is there. The substance of it is quite good for cannabis. If you go through it section by section, you'll find that most of it could work really well for cannabis. So we'd also have strict regulations around packaging, including a requirement for childproofing, and growers would be required to specify the potency of their products on their packaging, and that would be independently audited as well. In terms of edibles, anyone who wanted to sell a cannabis-based product that wasn't raw cannabis, we would have them apply for approval separately, and they'd have to jump through various hoops, such as showing that their product had a low risk of harm and it wasn't marketed to young people, and it wouldn't appeal to children, and that the packaging was all right, and various things like that. And then obviously pricing is really key in terms of regulation. We know particularly from regulating tobacco that the best way to keep use down is to keep prices high. So we want to make sure the price of cannabis is high enough to stop demand increasing, but we don't want to put it too low because then the black market steps back in again. So we need to control pricing with taxation, and we'd have a minimum price based on the potency. So higher potency products would fetch a higher minimum price, simply because we want to steer people away from using more harmful, higher potency products. We'd also have levies payable on each purchase, with all proceeds from the levy would be earmarked and put into a separate bucket specifically to cover first regulatory costs, but then drug-related harm reduction programs, treatment, prevention, all of those really key things that we've talked about quite a few times today. Also, that money should go towards regular monitoring and evaluation of the system to make sure it's working and it's not having unintended negative consequences. In terms of what the minimum price would be, we would imagine setting it somewhere around the black market level to begin with, maybe slightly lower to take the stuffing out of the black market. And we think if we follow this quite restrictive model that we've set out here, then and also combine it with effective treatment, like I said before, then we don't think that cannabis harm rates should rise significantly over time. As Anne McClellan pointed out before, we think that probably people would try it out more, so there would be a spike in use rates, but we don't think that the harm rate should raise significantly. Again, provided we put proper money and effective money into treatment and prevention and education. So that is a broad overview of what we're suggesting, and we would love to hear what you think about it. As I mentioned before, it's a conversation starter. So please let us know how you think we can improve it. And if you go to that website, you should be able to make comments. Hopefully that's just gone live. Hopefully we'll also take a couple of questions if we have got time, but Yep. So I think what our proposal comes down to in the end is, what would you want for your child, partner or grandchild? If they were struggling with drug use, would you choose a compassionate law that focuses on getting them well, or would you choose prosecution, punishment, and a criminal record? So I hope that in 20 years' time, we'll be looking back on today and laughing at the old-fashioned ideas we used to have about drugs in the same way that we now laugh about the idea that mixed flatting is outrageous. Whakawatea te Huarahi, aha koa he iti, he pounamu, e ngā mana, e ngā reo, e rauranga ti rā mā. Tēnā koutou, tēnā koutou, tēnā koutou katoa.
Kali? Excellent. We literally have time for 2 questions, so let's have the 2 best questions in the room. Yusuf.
Easy questions, please.
I'm Shane Lebrun from Medical Cannabis Awareness New Zealand. Under your proposed policy, are there any sort of exceptions or any guidelines on the medical cannabis side of things? Because a lot of patients will sit at home and think 3 plants isn't enough.
Right, okay, yes, sorry, I should have mentioned medical cannabis in the talk. So under this model, the pharmaceutical model of medical cannabis could continue as it's going, so we could have the same products coming in, and we'd like to see that beefed up significantly in terms of better funding, better access, easier import, that kind of thing. And then also, of course, because cannabis would be legal, you'd be able to use cannabis therapeutically for pain relief and that kind of thing, if you wanted to, without any legal penalties. In terms of the number of plants, yes, I think it would be good to have some kind of regulation in there about exceptions for the number of plants for those who need more, and we could definitely look at that kind of detail when it came to drafting a law around it. Absolutely.
Excellent, thank you. And here. Yes, that's you.
Paula Snowden. At the moment, in many places in New Zealand, marijuana is harder to get and more expensive than meth. Does your policy have levers that can be used to drive behaviour from meth to marijuana? Because the price issue won't work unless you can deal with the meth price issue.
Okay, I think when we're setting prices, we have to think about all different aspects of the issue, and meth use might be one of them. I don't think we have really good research to show yet in what way marijuana and meth are interlinked in terms of pricing and incentives. They're quite a different sort of a high, so I suspect that they're quite a different kind of a, so I don't know that they would necessarily be complementary. So if you made marijuana cheaper, would that lower meth use? We don't really know, but we should definitely take it into account when we're setting pricing, and it would be great to do a bit more research around that to see if it does have an impact.
I know I said 2, but one more. Make it quick.
Kia ora, Kiri Ellen, Labour's East Coast candidate, and thank you very much for your excellent presentation this afternoon. We're sitting here going, yes, yes, yes. One question I do have though, and it's probably just coming up out of interest over the course of the day, really want to acknowledge these fellas over the back, that they're keeping meth at the forefront of my mind at the very least. I'm really interested in what the Drug Foundation, this is great in terms of what you want to do in regards to cannabis. What about pee? Because that's the thing that's destroying my families and communities up the coast. Really interested to hear where the Drug Foundation's at in terms of what your approach is to methamphetamine and addiction.
Yeah, so I guess that's covered under the decriminalisation model that we're proposing. So you wouldn't be penalised anymore. You'd be offered much better access to treatment at a much earlier stage. That's the idea with that. So on the first caution with meth, because it's category A drug, you'd be sent along to see whether you needed further assessment and treatment. So it's a combination of removing the criminal penalties and then really beefing up harm reduction and treatment and prevention kind of things. and really making sure that those interventions are really effective and that there's a whole range of different treatment options available. It's not just one thing or another. There's whānau-based options and one-to-one options, and you can go into a treatment facility. Or there's a whole different range of things that you can do, and that it will be suited to the person and led by that person as well. So that's where we're at with that. Yep.
Thanks, Kali.
Thank you.